The numbers are startling and they have been problematic since the start of the pandemic. I'm here in front of Tyndall Retirement Home in Mississauga, one of 216 long-term care homes in Ontario dealing with an outbreak. Some doctors say long-standing staffing issues are to blame as COVID-19 rips through nursing homes in the second wave.
This is why we've seen such a huge challenge during this pandemic in Ontario, where so many of these workers, for example, are bringing COVID into the homes, because frankly, a lot of folks really don't have the choice of taking a day off when they really don't have great sick benefits to begin with.
Dr. Samir Sinha says the majority of the about 100,000 people working in long-term care settings are part-time workers.
When you hire someone on a part-time basis for a full-time basis, a full-time unionized worker will get 10 to 14 days of paid sick leave every year. A part-time worker, you only have to give them about 1 to 3 days of paid sick leave. It creates what we call a moral hazard, because all of a sudden now these folks, who really have a decision where if you have a bit of a sniffle or a symptom that might be COVID-like, and you're told to stay at home and not come into work that day, that might just mean a day without pay.
Staff shortages were an issue even before the pandemic. The province has pledged to spend up to $1.9 billion every year by 2024 to 2025 to create 27,000 full-time equivalent jobs in the sector. Minister of Long-Term Care's office also saying in part they've enhanced testing requirements in homes to reduce the risk of the virus coming in from the community and allow homes to detect COVID-19 cases earlier.
Although we're doing weekly testing in the lockdown zones, the gray zones, and testing every other week in the other zones, people can be tested one day and 2 days later test positive, but they don't actually get their test for another week.
The CEO of the Ontario Long-Term Care Association, Donna Duncan, says the government is moving too slow. Over 1/3 of long-term care homes are dealing with an outbreak. That's 216 homes. The big ones are St. George Care Community in Toronto with 81 current resident cases, 6 deaths, and 51 infected staff members. Tender Care in Scarborough has 62 resident cases, 64 deaths, and 16 infected staff members. In total, 2,830 residents have died, including 35 yesterday. 8 staff members have also died from the virus. Duncan says a lot more staff are testing positive in the second wave. Dr. Sinha says more testing isn't the solution.
We spend over $5 million a week testing these people, trying to see if we can keep COVID out that way, where frankly, it would work far better if we actually just paid them a living wage, number one, because you'd recruit more people and keep more people in these homes, and number two, actually give them proper sick benefits.
Dr. Sinha says because of low pay, many part-time workers may be living with multiple people in a home in a neighborhood that's in a hotspot. They may be spreading that virus inside the home as well as in the care center, making community transmission a big problem.